Tambul una ado. Mina Dr. Frances Wui, Doctor for them belle umandem and the uman sikrem. We hope say una all they do very well. Today we want to talk about sexually transmitted infections. That's not the infection they're waking past through mommy and daddy business. The World Health Organization say about 1 million people every day between the ages of 15 to 49, they get the infection here so every day. Now this age group is so important because now during this time woman gets belly and born picking, and most of the infection here so not get any symptoms, really make it difficult for people and for no pass you go hospital for be tested. Some of the infection here so unago sabi HIV, hepatitis, herpes simplex virus, human papilloma virus, chlamydia, gonorrhea, and syphilis. Syphilis and gonorrhea are two infections that we can consider very important for human reproductive life because they can lead to what we call pelvic inflammatory disease, where you carry belly at bad offensive discharge and maybe even pain during sex. Sometimes if you treat them the infection they are so inappropriately, you can end up for the get blocked tube, which can make it difficult for you get belly. Hepatitis B, we know say involve the liver, so sometimes if not something we know so you get it can progress and lead to something like liver cancer. HIV we all know about as well. That's something where we know say if you're not on a treatment, if you know they take your medication, the progression to AIDS can be rapid. Some of the infection there, so we know say you can get them through vaginal sex, you can get them through oral sex, you can get them through anal sex as well. So now make we really advocate for safe sex practices. Make sure say you abstain if you not already yet forget sexual intercourse. Make sure say you faithful and hope say your partner stay faithful, and then use condom use if you're not so sure as to waiting they happen now in our sexual life. But some of the infection there also can happen through mama to pikin, especially where you get belly or during the delivery process, or even where they breastfeed. So in final we also take that into consideration. I already don't say most of the infection here so asymptomatic. So unless you go to hospital, then test you're not able for know most of the time. But sometimes then you can get strange ulcers, sores, we go come on your private parts. You go begin think say, hey, something is wrong. You will get painful urination where you do wet to the act, or painful sexual intercourse, as I don't mention before. All of them things then they are things that we go click on your mind and say, I think say I need for be tested. Treatment mostly, let's say HIV we know say no get cure, hepatitis B we know say no get cure, the herpes simplex virus self we know say no get cure. But now medication and day where you can able for take for ensure say the progression slow. That's not the important thing. But again, if you're not tested, if you don't know your status, you're not gonna know how to proceed. Things like syphilis, gonorrhea, they want and then get treatment, and I follow you there on the appropriate bacterial regimen so that you and your partner, it's not a one-sided thing, so that you and your partner go able for be cured. Syphilis, hepatitis B, HIV, those are also part of the antenatal protocol. So if you're not belly woman with the kind of hospital, then are one of the things that we will test for, because we don't want like EB to say EB transferred to you picking. Where it comes to treatment, one of the things I want to highlight is the drug resistance. We know so within a country where people think able for go to any pharmacy and buy medication. Now, if you don't take antibiotic for other things or inappropriate use of antibiotics, something and then now where you need for treat then condition there, so it no go work for you. And I think that we're going to talk about resistance. So we appeal that unless a doctor writes a prescription for you for a particular infection, please not make a habit of going to the pharmacy for get medication, because you're going to develop resistance. Waiting also important for know, as I say, the infections there, so they get implications where it can impact woman their reproductive, sexual and reproductive life. We get stigmatization, for example, because person remember say, hey, if I go test and I know say I get this sick, maybe how people then go watch me if they know. Especially I'll talk about HIV, for example. If people then know say they get HIV, some woman are not comfortable for tell the man. Same way, some man are not comfortable for tell the woman. You remember say this person go left me. You remember say this relationship will end. But I think say the important thing is for no say if you get an infection, if finally you get open communication, because you also they think about that person the immune health and immune life. So open communication we can declare so it's very important, and I know say that not in the background for possible stigmatization. And finally, we don't talk about infertility, we can by especially chlamydia and gonorrhea, cancers, because like human papilloma virus, something will cause a cervical cancer, oral cancer, throat cancer, other kind of cancer. Them is very important, which is why we advocate for cervical cancer screening, HPV. Let me able to know if this person get HPV, especially pregnancy complications. People that we get certain of the conditions here, so can get stillbirth, and the pikin they die inside belly. You can get prematurity, you born the pikin before time. Sometimes the pikin will born and you get some kind of infection where you need for theater, and then neonatal infections, then they can lead to death for the pikin there. So sometimes, so it's very important that belly woman them, I talk about all women, but belly woman them especially be tested for certain infections so that they're not able to transmit this condition to them picking them. Some of them condition there, so you get, if you not get HIV, they make a higher chance for let you get HIV. So again, another reason why you for the screen and know if you get them condition there. So my end message is open communication, because you and your partner need for able for know within our health status where you can pass sexually transmitted diseases. So open communication for definitely day. We advocate for regular checkup. We advocate for let it be like for say if person notice anything different, let him for Kana hospital and be tested. But bottom line is abstain if you know say you're not ready for sexual intercourse. Be faithful to your partner and use condom. Till next time, me and Dr. Frances Wuri, they wish you all a happy and a healthy week ahead.